If your hips and your pelvis look like this, called an anterior pelvic tilt, you may have been told that it's because you have weak abs, tight hip flexors, and your glutes are shut off. But then, how do you explain why so many high-level athletes have this pelvic tilt and how it can actually be useful for improving force production? Or perhaps you've been told that this anterior pelvic tilt doesn't really relate a whole lot to pain and discomfort. And the research on that is mixed at best. Some studies show there's no relation whatsoever. Others show there might be a slight correlation. Yet having an anterior pelvic tilt that's beyond the normal 4 to 10 degrees that's prevalent, yes, this is normal, might be an issue in certain cases. But what are those cases? And let's not even talk about pain. Maybe you just don't like the appearance of it. Perhaps you're like me, or you have the appearance that you have way more abdominal fat than you actually do because of the change in your pelvic tilt presentation. How do we navigate all of this confusion around this pelvic tilt? After you're done watching this, you're gonna learn when an anterior pelvic tilt is actually a problem, if you actually have it, because sometimes it can look like you have that tilt, but you don't. And most importantly, what's the actual fix for this problem? And guess what? It's not stretching your hip flexors and strengthening your abs. We have to first recognize that some degree of anterior pelvic tilt is normal. Somewhere around 4 to 10 degrees is common. And actually, according to this study that was done in 1955, standing x-rays showed that the overwhelming majority of people have some degree of sacral nutation, which is when the sacrum tips forward, and that creates a slight degree of anterior pelvic tilt. But what a lot of the anterior pelvic tilt skeptics won't tell you is what else is associated with anterior tilt that could be a problem. And for that, we have to look at these two studies right here, which show that when an individual expresses a significant degree of anterior pelvic tilt, there is a loss of hip range of motion. Specifically, you'll oftentimes see in these studies a decrease in available hip internal rotation. When there's a loss of hip motion, now our ability to distribute forces and pressure is reduced to more focal areas. A reduction of hip internal rotation is often seen in subjects who have advanced hip osteoarthritis. It's called the capsular pattern of the hip. But you'll also see it as a potential risk factor for an ACL tear, and the less hip motion that I have available, that could contribute to increased load in areas such as the lower back. This study right here shows that when I experience back trouble or discomfort, there's increased stiffness in the lower back. If I have an increased anterior pelvic tilt to the point where I'm restricting motion in the hip, that could be a contributing factor to some of this lower back stiffness. How does this relate to static posture and the appearance issues that sometimes people can sweat over when there is an anterior pelvic tilt? When you have less postures and positions that you can assume, that's really when things such as anterior pelvic tilt become a problem. It's not the posture itself, but it's the lack of having the ability to explore other postures and positions. So how do I know if the degree of anterior pelvic tilt that I have is beyond that normal 4 to 10 degrees? Because here's the problem. It's really hard to measure that visually. So what's our alternative? If we know that increased anterior pelvic tilt has a drop-off in range of motion, if we check our hip range of motion, we might be able to determine if the degree of this posture is influencing our ability to move. Because when I tilt the pelvis anteriorly, it will change the orientation or position of the acetabulum, which is the hole that the femur sits in. That's going to change what motion is and is not available. When I anteriorly tilt this pelvis, it gives the appearance that there is a magnification of internal rotation. And that's because as the pelvis tilts forward, the acetabulum points more inward. And when the acetabulum points more inward, it allows IR to be present. But what it doesn't allow is external rotation to be as readily available. Now you might be thinking, Zach, you just said anterior pelvic tilt in the research shows a drop-off of internal rotation, yet you're saying right now that you're going to have more? Well, that's because the internal rotation that you're seeing is only present because of a change in pelvic tilt angle. It would be just like me tilting my torso downward and seeing as though I have more shoulder internal rotation, but I don't. All I've done is move my torso in this case to give the appearance that there's more internal rotation, but it's not happening at the shoulder joint. The same thing is true at the pelvis and the hip. If I tilt the pelvis forward or anterior, it gives me the appearance that there's more hip motion, but it's not happening actually at the hip. You can test this on yourself. If you lie on your back and you have your hip and knee flexed at 90 degrees, or you can have a partner do it, normal or average hip internal rotation is about 40 degrees, and external rotation is about 60 degrees. If I have less than 60 degrees of external rotation, and I have close to 40 or sometimes beyond 40 degrees of internal rotation, chances are you're having an anterior pelvic tilt that is beyond what we would consider normal. If you're still not sure, what also happens with this anterior pelvic tilt is a magnification of the straight leg raise. A normal straight leg raise is somewhere around 70 to 90 degrees. So if you are within that normal range or well beyond, and you have that hip rotation presence, then chances are you need to address the degree of anterior pelvic tilt that you're expressing. And the reason why the straight leg raise can often appear to be a lot is because when the hips tip forward, the upper part of the hamstrings, or the more proximal part of the hamstrings, becomes eccentric or elongated, allowing me to lift my leg up higher than I might normally be able to. And so it may be that you have these exact findings. Well, what do I do? How do I address my motion so I increase my hip mobility so my anterior pelvic tilt isn't the only strategy that I have available? We have to look at where we have increased muscle activity when we experience a significant anterior pelvic tilt. The anterior pelvic tilt is created when I have increased muscle activity of musculature that's at the top portion of the pelvis. So you could think upper glutes, back muscles, etc., etc. That's going to cause this pelvis to tilt more forward. And then the front part of the pelvis, the pubic symphysis, is going to point more downward. When the top part of the pelvis is more concentric, or these muscles are more active, the bottom part, where the distal or lower portion of the glutes and the proximal or upper portion of the hamstrings are, is going to be more eccentric or elongated. And it's not that it's weak, it's just based on the position. Certain muscles or certain portions of muscles have more leverage than others. The solution is to utilize strategies that increase muscle activity in the bottom portion of the pelvis, and that by default ought to reduce muscle activity in the upper portion of the pelvis, allowing us to not only have that anterior pelvic tilt, but to move our hips freely. So then the solution must be to just tuck the hips and life will be good, right? Right? Wrong. And here's why doing a posterior pelvic tilt or a hip tuck could actually be the worst thing you could do to treat this issue. Suppose that I wanted to bend my elbow, but I only had 90 degrees of elbow flexion. Well, I'm not going to be able to get my elbow well beyond that if that's the limit. The same thing applies if I have an anterior pelvic tilt and I have a lack of ability to posterior pelvic tilt. How are you going to perform this action if that motion currently doesn't exist because of increased muscle activity. Your body is going to find another way to create that movement. Instead of actually getting a change within the pelvis, you'll see folks end up bending through somewhere in the lower back to achieve that exact same movement. This is most commonly seen when someone advocates for a cat-camel drill. A lot of times you will not see much movement happening at the pelvis, but instead an orientation through the lower back. Well, guess what? That's not going to do piddly-diddly for the changes that we need in the pelvis. Instead of trying to tuck the hips, we have to find a better way to increase muscle activity in this lower musculature so it allows us to get the movement changes that we need without the negative effects. And the way we can do that is by pressing into the ground in a specific way that allows us to engage that area and breathe in a specific manner that helps shift the abdominal contents backwards, so that way the backside musculature can relax and you minimize the orientation or movement happening through the lower back, truly isolating it to the pelvis and improving your mobility. But in order to increase your odds of success, you have to approach this in a specific sequence. I'm going to show you what that sequence is with 3 different exercises. The first move is a wall squat with a low reach. This move will encourage the lower glutes and hamstrings to engage. First thing I'm going to have Chris do is be about his foot length away. He's going to fall back onto the wall just like that. Let the knees softly bend about 1/4 of the way down. What you don't want to do in this is flatten your back aggressively against the wall. Because if you do that, you're going to end up orienting through your lower back and you're not going to get the changes in the pelvis. Eyes are going to look straight ahead. You want to soften the knees and make sure that your feet are contacting through the inside heel and the base of the big toe. From here, Chris is going to reach his arms at about a 60-degree angle like he's trying to pick up a young child. Silent in through the nose, nice soft exhale, and slowly reach the arms forward without the upper back coming way off of the wall. You're going to do 4 sets of 5 breaths. Once you've finished that move and you feel pretty good about it, you can then switch to the wall push, same connect. On this move, the cues are going to be very similar. I'm going to have Chris push through the inside heel and the base of the big toe into the wall on the right leg, which is going to engage his glutes and hamstrings. On the left-hand side, he's going to lift his left leg off, gently squeeze the block so he engages the abdominals. This is going to push the abdominal contents towards the lower back, which will reduce the back arch and encourage less of an anterior pelvic tilt. The same breathing is going to occur, silent in through the nose, nice, soft, and slow exhale through the mouth. Making sure that as this happens, the lower abs slowly sink down towards the ground. With that move, you want to do 3 sets of 5 breaths per leg. Once you've mastered that, it's getting easy. Maybe you've seen some changes in your hip rotation. You're then going to move on to hook-lying breathing. And to make your life easy, the cues are going to be exactly the same. I'm going to make sure that Chris gets his pressure through the inside heel and the base of the big toe on both feet. He's going to press straight down into the ground without tipping the feet inward. Once he has that pressure, he's then going to gently squeeze the yoga block, just like so. And the breathing sequence is going to be exactly the same. Silent in through the nose, nice, soft, and long exhale through the mouth, making sure the ab wall drops down towards the ground. Try this for 5 sets of 5 breaths. The thing you have to be careful with the most on this move is the degree that you're pressing into the ground. You want to get this up to about a 5 out of 10 effort, because a lot of times what will happen is if you push too hard, the back is going to come up off of the ground, almost like you're doing a classic glute bridge, but I ain't about the classics in this case. You want the pressure to be straight down and gentle. The other issue that oftentimes happens with this move is people will tuck the hips. Again, we don't want to do that because that's going to just create the movement from the lower back and not through the pelvis. Now, what if you try these movements, but you still notice that your lower back arch is pretty deep, and maybe you didn't get all of the movement improvements that you want? You might actually have to address something else called a rib flare, which I'll show you how to do that in this video right here.